Hello and welcome. When you think of a stroke, you probably picture a man clutching his arm, his face drooping on one side. We've all seen this image. But what if I told you that for many women, a stroke doesn't announce itself so dramatically? What if the warning signs are far more subtle, more confusing, and tragically, more often dismissed? Today we are discussing the 5 silent but deadly stroke signs in women over 60 that are not numbness, and why knowing them could be the most important health lesson of your life. A stroke, or a brain attack, occurs when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. It is an absolute medical emergency. Every second counts. This is why recognizing the signs is so critical. The classic acronym F.A.S.T, face drooping, arm weakness, speech difficulty, time to call emergency, is a fantastic tool and has saved countless lives. It primarily describes the symptoms of a stroke affecting the major motor pathways in the brain. However, there is a dangerous gap in public awareness, the gender gap. Research has shown that women, particularly as they age, can experience a different set of stroke symptoms. These symptoms are often described as atypical or non-traditional, but they are very real and just as dangerous. Because they don't fit the classic picture, they are often dismissed by the woman herself, her family, and sometimes, tragically, even by medical professionals in the emergency room. They might be attributed to a migraine, a panic attack, or simply not feeling well. This delay in diagnosis can be the difference between a full recovery and lifelong disability or worse. In this guide, we are going to shine a bright light on these deceptive symptoms. We will move beyond the classic signs and equip you with the knowledge to recognize a stroke in yourself or a loved one, even when it presents in disguise. Understanding these 5 silent signs is not about creating fear. It's about creating empowerment. It's about giving you the tools to be your own best health advocate. Let's begin with a symptom that is often mistaken for a common ailment, but can be a sign of a neurological emergency. Silent sign number 1, a sudden severe headache. Many of us get headaches. They are part of life. But the headache associated with a stroke is different. It is often described by patients as the worst headache of my life. It comes on suddenly, like a clap of thunder, and is explosive in its intensity. It's not a dull ache that builds over time. It's a sudden, blinding pain. This can be a sign of a hemorrhagic stroke, where a blood vessel in the brain has actually ruptured and is bleeding. The pain is caused by the blood irritating the brain tissue and increasing pressure inside the skull. What makes this sign so deceptive? Women are more prone to migraines than men, so a severe headache might be dismissed as just another bad migraine. But here's how to tell the difference. A stroke headache is typically sudden and unusually severe, and it may be accompanied by other neurological symptoms we will discuss, like dizziness or vision changes. A migraine often has a more gradual onset, may be preceded by an aura, and often has a history of similar occurrences. The key takeaway is this. If you experience a sudden severe headache that feels unlike any you've ever had before, it is not the time to take a painkiller and lie down. It is time to call for emergency help. Silent sign number 2, sudden dizziness or loss of balance. This is another symptom that is easy to dismiss. A feeling of dizziness, vertigo, the room spinning, or a sudden problem with coordination and walking can be signs of a stroke occurring in the cerebellum, the part of the brain at the back of the skull that controls balance and coordination. Patients might suddenly feel like they are drunk, unable to walk in a straight line, or find themselves stumbling and falling. This is often confused with an inner ear problem, low blood sugar, or even just a dizzy spell. But the key word, again, is sudden. It's not a gradual feeling of unsteadiness. It's an abrupt loss of equilibrium. If you or someone you know suddenly cannot walk properly, is veering to one side, or feels intensely dizzy without a clear cause, think stroke. Don't wait to see if it passes. Time is brain.
Our third silent sign involves your eyes. A stroke can cause a wide range of sudden vision problems in one or both eyes. This happens when the stroke affects the parts of the brain responsible for processing visual information, like the occipital lobe. The symptoms can be varied and confusing. It might be a sudden blurring or dimming of vision. It could be the sudden onset of double vision. Or it could be a sudden, painless loss of vision in one eye, like a curtain coming down. Another deceptive sign is the loss of one half of the visual field in both eyes. For example, the person might suddenly be unable to see anything to their left side. They might bump into things on that side, or only eat the food on the right side of their plate, completely unaware that the other half of their world has visually disappeared. Because these symptoms can sometimes be painless and affect peripheral vision, they can be easy to ignore or rationalize. A person might think their glasses are dirty or their eyes are just tired. They might not realize the severity of the situation. The crucial clue is the suddenness of the onset. Any abrupt, significant change in your vision is a red flag that requires immediate medical attention to rule out a stroke.
Silent number 4. Sudden confusion or trouble understanding. This is one of the most subtle and frightening signs. A stroke can affect the parts of the brain responsible for language and thought, leading to a state of sudden confusion. The person may suddenly be unable to understand what others are saying, even though they can hear the words perfectly fine. It's as if everyone started speaking a foreign language. They might also be unable to speak coherently themselves. They might try to say something, but the words come out jumbled and nonsensical. This is called aphasia. It can also manifest as disorientation. The person might suddenly not know where they are, what day it is, or recognize familiar faces. This is often mistaken for delirium, a medication side effect, or even the onset of dementia. But unlike dementia, which develops gradually over months or years, this confusion is sudden. It's a dramatic shift from their normal mental state just hours or even minutes before. If a loved one suddenly seems confused, disoriented, or unable to speak or understand, this is a major neurological warning sign. Silent number 5. Generalized sudden weakness. We all know about the classic sign of weakness in one arm, but some strokes, particularly in women, can cause a feeling of sudden generalized weakness all over the body. It's not localized to one side. The person might suddenly feel so profoundly weak and fatigued that they're unable to move or even sit up. They might describe it as a sudden, overwhelming wave of weakness. This is perhaps the most easily dismissed symptom of all. It can be easily mistaken for the flu, an infection, or simply exhaustion. The person might just want to go to bed and sleep it off. This is a dangerous mistake. The key differentiator is the sudden and profound nature of the weakness, which is out of proportion to their recent activity levels. It's not just feeling tired, it's a sudden, debilitating loss of all strength.
So, let's review our 5 silent but deadly stroke signs in women. 1. A sudden, severe headache, unlike any other. 2. Sudden dizziness, vertigo, or loss of balance. 3. Sudden vision problems in one or both eyes. 4. Sudden confusion, disorientation, or trouble understanding speech. 5. Sudden, generalized, and profound weakness. The common thread through all of these is the word sudden.
These are not symptoms that develop over days. They happen in an instant. If you experience or witness any of these signs, what do? The answer is simple and non-negotiable. Call for emergency medical help immediately. Note the time the first symptom appeared. This is critical information for the doctors. Do not drive to the hospital yourself. Paramedics can begin life-saving treatment on the way. Do not wait and see if it gets better. Every minute that passes, more brain cells are lost. Recognizing these atypical symptoms is a superpower. It allows you to be an advocate for your own health, for your mother, your sister, your friend. It's about turning confusion into clarity and helplessness into swift, life-saving action. This kind of critical health knowledge can truly save lives. If you believe this information is valuable and want to learn more science-backed strategies to protect your health as you age, please subscribe to Dr. Maskola. Share this video with every woman you know. It might just be the most important video they ever watch.